Hi guys, so I'm with Sally and Claire here. Would you guys like to introduce yourselves?
Hello everyone, my name is Sally. I'm the Head of School for Nursing, Midwifery and Health Education at the University of Bedfordshire.
Good morning, my name is Claire Kane and I'm Principal Lecturer and Portfolio Lead for Nursing here at the University.
And what courses do we have on offer here at the University of Beds with nursing, healthcare and midwifery?
Okay, I'll talk to you about Midwifery and Nursing Associates and Claire will talk about nursing. So we have midwifery courses. So we have a midwifery course for someone that's never done any training before. So that's a 3-year direct entry BSc course. And we also have a master's course in midwifery for someone who's already done their nurse training, an adult nurse, and then can come and do a shortened 2 years to become a midwife. We also have our nursing associate courses. Those are generic courses that are 2 years long, and students who complete their nursing associate courses are registered with our regulatory body, the Nursing and Midwifery Council, and can in subsequent years come back and then do further training to become a registered nurse. And our nursing courses, Claire?
Yes, we have two sorts of different types of nursing courses. We have the BSc course and we have the MSc course. We also have the apprenticeship route as well. So the BSc course we run in mental health, child and young people and adult nursing, and that's a 3-year direct entry course. We also have the apprenticeship course for that as well, so that's 19 months for someone that's maybe got their nursing associate course and been working as an HCA in practice beforehand. We also have our MSc course as well, which is a 2-year course in mental health and adult nursing, and we expect someone to have 600 hours of HCA paid employment beforehand and a degree that relates to nursing as well.
And throughout all those courses there must be a lot of staff, so what expertise and what backgrounds do all of these staff bring to all of these courses?
We have a whole range of staff and they're really dynamic, and we've got some new staff in from practice as well, which is really great. They're bringing the very latest experience from the NHS. So we have people who've been working in the emergency departments, in intensive care, in rehab, palliative care, a whole range of experience in nursing.
And in midwifery and nursing associate, we also have a similar range of staff, but obviously they're working in midwifery if they're midwifery staff, so they have a lot of clinical experience. And as Claire was saying, very recently we've got visiting clinical fellows. So these are clinical experts. So not only do you have educationists who have really sound educational principles, but you have clinical experts, consultant nurses who come in and give you the very latest clinical practice. And that's a fantastic opportunity for our students.
And throughout all of the degrees, what placements and what links to employers is available to students?
I mean, that's variable depending on the course. So if I'm talking about midwifery, we have fantastic practice partners and we have wonderful relationships with them. We work really closely together in everything that we do. So for midwifery, our students can be based in our Bedfordshire Hospitals NHS Trust, which covers Luton and Bedford, in Buckinghamshire Hospitals NHS Trust, who's at the Stoke Mandeville site, but we also have students in Wexham Park and Milton Keynes. So we have a range of experience for our students. Yeah. And in nursing?
Yes, and in nursing the same as well. We work very closely with our practice partners. So we train our student nurses in Bedfordshire, in Buckinghamshire, and in Buckinghamshire we'll train our student nurses at Buckinghamshire Healthcare Trust, and they have 3 hospitals. That's Amersham Hospital, Wickham Hospital and Stoke Mandeville Hospital, where incidentally we have a site, so we'll talk about that in a minute, but also Milton Keynes as well. We train our student nurses at the L&D in the community setting, sorry, that's the Luton and Dunstable Hospital, in Bedford Hospital and in the community settings as well.
And what facilities and where will the students be where will the students be studying during their time?
Okay, so we have 3 campus sites for nursing and midwifery. That's in Bedford campus, Luton campus here, and in Aylesbury campus as well. Aylesbury campus, I'll tell you a bit about that. It's a new campus site, so it was up and built just before lockdown. Okay, so it's still really brand spanking new. It's actually on Stoke Mandeville Hospital site, which is fantastic because you're really close to the hospital. Okay, so we have these really strong ties with all our practice partners anyway, but you're actually there on site. In fact, we look over the site of the Paralympics behind us, and we've got all the training tracks behind us because, of course, you will all possibly know that Stoke Mandeville Hospital is famous for its spinal cord injuries department there as well. And what else were you talking about?
I'll ask another question. So what are the key skills, and what are some of the skills that employers will come out? What are some skills that the students will come up with afterwards, when they go into employment?
Okay, well, a full range of skills, because the Nursing Midwifery Council expect our student nurses to have an experience of every area of nursing. So, for example, when we're looking at placing our student nurses, we think they have to go to surgical nursing, to medicine, they have to go to critical care, they have to have a community experience, a learning disability experience as well. So they come out with a range of experience. Towards the end of semester year 3, their last placement, they can actually express a wish as to, you know, what they want to specialise in as well. It's quite often that they almost use it like an apprenticeship at the end of the course, if you like, and they often stay in their last placement.
Oh, brilliant. And
For midwifery, midwifery is very regulated in terms of what students have to do. I mean, in a similar way to nursing, but in midwifery, our midwifery students have to have certain numbers of experiences to make sure they have all-round experience. So, for example, all midwifery students have to deliver between 30 to 40 babies during their 3 or 2 years with us. So they're personally delivering those babies. They have to witness births, they have to examine at least 100 women antenatally, and postnatally they have to examine 100 babies. So there's a wide range of skills, but not only that, they have to develop clinical excellence in things like breastfeeding skills, because that's really important. And we're very fully supporting the Baby Friendly Initiative as a university, because that's very important for us to support women to be successful, because babies that are breastfed are more likely to thrive. So we fully support that, but we also teach our students the skills of actually how to artificially feed the baby using a bottle. So they have a wide range of experience, and we have lots of theory and lots of practice. So it's 50% theory, 50% practice for all of our courses. So they'll start off with us for, say, about 6 weeks in the university, where we will give them not only theoretical knowledge, but we will bring them in laboratories like this, our skills laboratories, and they will be able to practice a number of nursing and midwifery skills before they go into practice. And that's essential. You know, actually, for many young people, actually touching another person, but seeing a person naked is a very new experience. So actually having the opportunity to work with our mannequins, and we're in our skills, one of our skills labs at the moment, which you can see is set up like a ward, they get the opportunity to practice in a safe environment. And then that gives them confidence when they actually have to approach one of our service users. So patient, client and carers.
All of the courses, they're very linked to employment afterwards. So do all of the students out the courses, do they all go into nursing, midwifery, and any sort of healthcare? So what's the employability like afterwards?
100%.
It's 100%. It's 100%.
It is.
Absolutely.
Yeah.
And if any of our students want a job, if for any reason they wanted to go and travel for a year, obviously they wouldn't want a job, but our students, we recruit students because we need them in the NHS. And so our local providers are telling us these are the numbers of students we need for our future planning. We recruit to that number and we support our students to be successful, and they then get a job normally in the practice area they've had their placements.
Absolutely, as I said, they normally stay in the placement, you know, when they've qualified. Their last placement is usually the placement that says, come and stay with us. So yeah, our student nurses, we can always tick that box and say 100% get a job at the end.
That's brilliant. And you said there about almost like a shortage of nurses, and especially at the moment, I've seen, it wasn't too long ago, there was in the news about shortages of nurses. But what would you say to someone that's sitting on the fence about what course they do, whether they're thinking about nursing or not? What would you say to someone that's thinking about that?
What I would say from a nursing and a midwifery perspective, and Claire, I'll talk more from midwifery, then you can talk nursing. So what I would say is it's a fantastic career. I have never regretted studying either nursing or midwifery. There are so many opportunities as a qualified nurse or a midwife. And so the benefits of that, yeah, you can stay in clinical practice and you become very senior, you can do a leadership role, you can become a consultant nurse or midwife, or you know, you can go into education. So obviously we chose to go into education, and then you're developing the future nurses and midwives, and that's incredibly exciting.
Absolutely, it's the same really for nurse. Well, it's no different for nursing at all.
We're going to walk and look at our labs while we're talking.
Oh, okay.
Are we? So we can actually have a look. Yes.
It's an incredibly rewarding profession to be in, and yes, you can be in it from 18 to 65 or 70. My own grandmother was still delivering babies in her 70s, in her early 70s, and went on to then use her nursing skills working in nursing homes after that. So yes, you can continue this for your whole life, or you can come into it for 10 years and maybe think, well, you know, I can use my clinical skills in education and that's where I'll go now, or go, you know, on the management route as well. So yeah, I mean, there's so much that you can do in nursing and midwifery.
And they're jobs for life.
Yeah.
So we've just walked from one of our clinical skills laboratory ward, and this is an area which is an intensive area. You can see we have a child that's being cared for in this area with the monitoring equipment that a very little child would need. This is some of the equipment that the staff would be using for whatever care needs this child had. So this is one of our smaller skills areas.
Yes, absolutely. So we also teach operating department practitioners here as well. So they use this a lot because this is made up to look like an anaesthetic room, so critical care. So where a consultant and an ODP will be looking after the patient's airway before they come through into the theatre area. As you can see, we have a full operating theatre area here, and we can convert this for general surgery to maybe a caesarean section. But we don't do those as nurses, obviously, as you know, but to mock up what it would look like. So a midwife or a nurse would know how to assist. So as you can see, we have the trolleys out here. We're very lucky here too. We have this latest equipment. We have this laparoscopic equipment where the ODPs are taught how to assist the surgeon as well. So we have this, and they learn how to
Support the surgeon, the scrub nurses.
yes, I was actually going to say lay all the sheets out properly as well, because that's a skill in itself.
And how often would students use this? Because is it a largely practical-based course where it's very hands-on and they use this quite often?
In the units of study in nursing,
for our nursing between the theory and the practice and developing skills, giving students confidence. So that's something we do a lot.
It starts in year one before they go to practice, when we teach them how to make a bed. And some people might think, well, really, is that important? It is, because actually that's how nursing starts. We start with a clean bed, all right? And you may think that's a bit of a strange thing, and why do we need to make a bed anymore? But actually, if a patient's lying on a sheet that's got crinkles in it, for example, it can cause a pressure ulcer. I know that sounds mad, but that is the truth, okay? So we teach our students how to make beds properly for infection control, but also to stop any other injuries to the patient. So really basic nursing skills we start off in our simulation labs, and we build up through the 3 years. They don't come to this first of all.
And one final question is there anything else that you guys would like to add that we haven't spoken about already?
Just that at the University of Bedfordshire, we pride ourselves on the support that we give our student nurses. So we have tutor groups now. That means that you have your personal tutor. They meet with you every week in the first 8 weeks in year one. Every single week for an hour. We discuss hot topics. We discuss things that are going on in the NHS. We discuss how you're getting on with the course, okay? It really is that personal care that we give. And you have that all the way through. So you have your personal academic tutor all the way through the 3 years. And we really pride ourselves on the support that we give our student nurses.
That's brilliant.
And I would say, not only that, we're very friendly. And I think that's very important. You know, when I speak to any of our applicants, what comes over, I think, is that Bedfordshire is a very friendly university. Yes. And that's important. To find someone that smiles at you and welcomes. So I think that's important. Our staff are very skilled, as Claire said earlier, so we have staff with massive skills who maintain their confidence and competence, not only visiting practice regularly, but also continuing with their own education. All of our academics actually are taught how to teach, so they go through a PG Cert qualification, so that they're experts in actually helping people to learn. But not only that, many of our staff then go on to doctoral study. And so then they're bringing their research back into the classroom to the students. So I think that gives an all-round experience for our students.
Thank you very much for this, guys. If you guys have any more questions at the end of this, we'll be able to get back to you. Just click the link on our social media and visit www.bedfordshire.ac.uk beds.ac.uk.
Lovely, thank you.
Thanks everyone. Bye.